My name is Tim Farrell. I'm a GI surgeon. I'm a professor of surgery here at the University of North Carolina and also serve as vice chair of the Department of Surgery for Education. My practice is centered on minimally invasive GI surgery for benign conditions like a hiatal hernia surgery for elderly men and women is very common in my practice, swallowing disorder surgery for people with gastroesophageal reflux disease or motility disorders like achalasia, and also weight loss surgery or bariatric surgery, which has become about half of my practice. Well, what gets me up in the morning is on days when I'm seeing patients, it's the opportunity to interact with people of North Carolina who are wonderful to work with. On days when I'm in the operating room, it's the joy of doing highly technical operations through small incisions and seeing patients go home in 1 or 2 days. And on days when I'm teaching, it's the pleasure of teaching advanced trainees and younger trainees at undergraduate level, things that I can do so that it can inspire them and get them to consider a surgical career. Well, I think my practice is one that has been here at the University of North Carolina since I came out of training. And I feel like although I'm a transplant to the area, we are growing deep roots in the red clay of North Carolina. I plopped myself down in a place where I felt like we could have a long-term relationship, both professionally and as a family. And so I've been here a long time, and it feels like I'll be here for the rest of my career. And I hope on the last day of my career, I'll still be doing the same thing I was doing on the first day of my career. My aspirations are not for, titles and leadership, but to continue to just do what I do better, safer, faster for my patients, and at the same time to have a thriving family in this area that can grow deep roots and hopefully have future generations in North Carolina. One of the benefits of working at the University of North Carolina is that our approach has been multidisciplinary care for patients. And so I work alongside experts in non-surgical domains. Gastroenterologists in the Center for Esophageal Diseases and Swallowing are expert and help me to provide a component of the care of patients with GI diseases, such as achalasia or hiatal hernias. But it's not weighted towards just surgical management. If it's correct for a patient to have surgery, of course, we are able to provide that and at the highest level. But in another case, if a patient needs their symptoms managed by non-surgical treatments, we have some of the world leaders in gastroenterology here. The same is true for bariatric surgery. Weight loss surgery is something that we have been doing since the early 2000s, shortly after I came to Chapel Hill. And we have developed the program carefully so that we're not treating patients as numbers, but as individuals. And now I'm excited to say we have colleagues in the Department of Medicine and the Division of Endocrinology who are experts in medical weight loss efforts. We have colleagues in family medicine, physical medicine, and rehabilitation who are providing top-level behavioral and exercise-related programs of weight loss. And we're getting better and better at integrating these into a program that allows us to tailor the treatment plan for a patient to minimize their risk, but to achieve the best outcomes. Under the leadership of our chairmen and women and our division chiefs, we've gotten a team that has longevity and great knowledge about the care of these patients. So I've had the pleasure of working with some of the best nurses and nurse practitioners and administrative support staff. And so I feel like when our patients or our potential patients contact our office, they're going to speak to individuals who treat them personally, who understand where they need to go. It's a big, complex system. Healthcare is across the board. I think the Division of GI Surgery and our staff are wonderful at helping patients navigate the complexities of getting to the right specialist. And I'm very pleased to have had the opportunity to work with the people I did.